Hi, I'm Dr. Alexis and I'm a practicing endodontist in Easton, Maryland. Some of you may know that root canals are one of the most feared procedures in dentistry. Usually this fear comes from the fear of the unknown or the expectation of pain. And many of my patients are surprised when I tell them that root canals are meant to be painless. Now, since I can show you better than I can tell you that root canals are meant to be painless, instead, today I'm going to walk you through the root canal procedure and hopefully minimize some of that fear of the unknown. The procedure begins with a clinical and radiographic exam. We obtain high-quality diagnostic images showing the tooth of interest and any pathology that may be visible radiographically. Additionally, sometimes a 3D X-ray is necessary for further examination. Next, the clinical exam is completed, which assesses the vitality of the tooth as well as the degree of inflammation at the end of the root. Diagnostic tests include cold and electrical testing, percussion, palpation, bite, and periodontal probing, just to name a few. Once the diagnosis has been determined, the findings are explained and the procedure is discussed. Any questions that the patient may have are answered and treatment begins. In our office, the dental operating microscope is used for all procedures to enhance visibility with magnification and illumination. An access cavity is created to gain access to the nerve chamber. We then go down the nerve channels, clean out the infected or inflamed nerve tissue, and fill the canal spaces with a sterile filling material, followed by a temporary restoration. Because some discomfort and pain is expected, a pain management regimen consisting of ibuprofen or Tylenol, and in some cases both, is recommended. Patients are also encouraged to chew on the opposing side until they can get the permanent restoration. This prevents loss of the temporary restoration and further damage to the tooth. Once the permanent restoration has been placed, the tooth is able to function as normal. Might I add that the root canal isn't even the most important step of this entire process. It's actually following up with your general dentist and getting the permanent restoration placed, whether it be a simple filling or a full coverage restoration like a crown. Without it, the tooth is susceptible to cracking, fracturing, and recontamination. I hope this video was informative and has demystified the whole root canal procedure. Thanks for watching.